Is your urine silently screaming kidney trouble? Seniors, watch these 5 signs. Have you ever heard the phrase, your body whispers before it screams? It's true, especially when it comes to your kidneys. You might feel fine. You might go about your day, eat your meals, take your meds, and sleep well enough. But meanwhile, your kidneys could be struggling, and you wouldn't even know it. The signs aren't always loud. No stabbing pain, no dramatic collapse. Just quiet changes, ones you may have noticed but brushed off. Like your urine suddenly turning darker than usual. Like foamy bubbles in the toilet that weren't there before. Like waking up more and more at night just to go to the bathroom. These aren't random. These are whispers. And if you're over 60, those whispers matter even more because 9 out of 10 people with kidney disease don't know they have it. Your urine is one of the earliest messengers. It's trying to tell you something long before you ever feel sick. So today, let's stop ignoring those signs. Let's listen to your body. And let's talk about what your urine might be silently screaming before it's too late. Have your socks been leaving deeper marks lately? Do your shoes feel tight by the afternoon? Or maybe you've noticed puffiness around your ankles, feet, or even your eyes when you wake up. For many seniors, the first instinct is to blame salt age or the weather. But there's something else you need to consider: your kidneys. One of the earliest signs of kidney trouble isn't pain, it's swelling. And often that swelling is connected to what's happening in your urine. Here's how your kidneys are supposed to filter out waste but keep important proteins like albumin inside your bloodstream. Albumin helps hold fluid inside your blood vessels, kind of like a sponge. But when your kidneys are damaged, they can leak this protein into your urine. You might see it as foamy or bubbly urine in the toilet. And when you lose that sponge-like albumin, fluid starts leaking out into your tissues, causing swelling or edema. Swelling might show up in your feet and ankles, your lower legs, your belly or hands, or even your face, especially around the eyes. And this isn't just cosmetic. It's a clue, a whisper from your kidneys that something is wrong. Swelling may also be linked to high blood pressure, low urine output, or salt retention, each of which connects back to kidney health. If you've seen swelling plus foamy urine, or if your swelling is persistent, unexplained, or suddenly worse, it's time to act. A simple urine test can detect protein loss early, and early detection means a much better chance of slowing kidney damage. Don't wait until your body starts shouting. If it's whispering, listen now. Sometimes the biggest clues in life come from the smallest details. Take a moment to think, when's the last time you looked at your urine before flushing? For many seniors, this simple habit could offer an early warning sign that the kidneys are in distress. Because color matters and your urine may be the first place a problem shows up. Let's start with the ideal color. A pale yellow or light amber. That's the all-clear signal. It means you're likely hydrated and your kidneys are working properly. Now let's explore colors that should raise your eyebrows. If your urine is dark yellow or brown, that may mean dehydration or even a urinary tract infection, especially if it smells bad or looks cloudy. If your urine looks like cola or tea, that could mean there's blood present even if you don't see red. This could be a sign of glomerulonephritis, lupus-related kidney issues, or other types of inflammation in the kidney filters. Bright red urine is even more alarming. It could mean active bleeding from the kidney's bladder or urinary tract. It could also point to cancer, kidney stones, or broken blood vessels. And while beets or some medications can turn urine red, don't take chances. If you see red and didn't eat beets, call your doctor. And finally, if your urine is white or foamy like a head of beer foam, it may mean you're leaking protein. That's one of the strongest early signs of kidney trouble. Don't ignore what your eyes can tell you. Look before you flush. And if your urine's color is off, check in with your physician. Pain during urination isn't something anyone should just get used to. It's your body's way of saying something's wrong. The most common cause is a urinary tract infection, which can affect both men and women, especially with age. It often brings burning, stinging, or an urgent need to go. The good news, it's treatable. But pain during urination can also point to other issues: kidney stones that scrape the urinary tract, an enlarged prostate in men causing pressure or blockage, urinary obstruction, leaving your bladder feeling full but not empty, or in rare cases, kidney infections, fans, or tumors. The important thing is this pain when urinating is not normal. It deserves attention. Even if it comes and goes, don't wait. Have your urine tested and talk with your doctor. Do you find yourself heading to the bathroom more than you used to? Waking up once at night is common, but 2, 3, or more times, that might be a sign of trouble. Frequent urination can come from simple things like drinking too much water or having caffeine before bed, but it can also point to deeper issues. Diabetes, your kidneys work overtime to clear extra sugar, chronic kidney disease. Your urine isn't concentrating properly, overactive bladder or nerve issues, enlarged prostate or infections. It's a myth that making a lot of urine means your kidneys are fine. In kidney disease, you might be producing urine, but that urine may not be doing its job. It's like water running through a broken filter. If your normal pattern has changed, especially alongside fatigue or swelling, talk with your doctor. Frequent urination may be your kidneys waving a warning flag. Have you noticed that you're peeing way more or far less than usual? A healthy adult typically produces between 1.5 to 2 liters of urine daily. But kidney problems can push you in either direction. If you're making less than 500 milliliters per day, that's called oliguria, and it's a serious concern. It could signal advanced kidney failure, dehydration, or a blockage. On the flip side, producing much more urine than usual, especially if it's clear and dilute, could mean your kidneys aren't concentrating waste properly. This is common in early stages of kidney disease. It might also be linked to diabetes, or even a rare hormonal imbalance called diabetes insipidus. And yes, too much water can be dangerous too. Overhydration can dilute your blood sodium, leading to weakness or confusion. So if the amount you pee has changed dramatically, whether too little or too much, it's time to ask your doctor why. It's not just a bathroom issue. It may be kidney trouble knocking at the door. Your kidneys won't always cry out for help. They won't always ache or throb or make a scene. But they will whisper through the color of your urine, the way your body swells the number of times you get up at night, or the quiet sting when you go. And for older adults, those whispers are even more important, because 9 out of 10 people with kidney disease don't even know they have it. And the earlier you catch it, the more you can do about it. So if you've noticed swelling, pain, foam, red urine, or sudden changes in how often or how much you pee, don't brush it off. Ask your doctor for a simple urine test. It could protect your kidneys, your energy, and your independence. Your body isn't trying to scare you, it's trying to protect you. So listen now before it screams.